Hello everyone. I am Sanjana, nutritionist from ZenOnco.io. Today we shall be speaking about chronic kidney disease and chronic kidney disease is also known as chronic kidney failure, and it is a condition wherein the kidney function gradually over time slows down. In cancer patients who already have a chronic kidney condition can be very challenging as well. Now, we know that cancer itself is a condition wherein the nutritional requirements, especially the calories and the protein requirements, will increase. Now, when we speak about a chronic kidney disease, yes, it is complex also, because we need to also limit the intake of sodium, potassium, phosphorus, and calcium as well. However, in today's session, I will not be going in depth to speak only about chronic kidney disease and the nutritional intervention. However, I am going to be speaking about how we can manage this condition when a patient is also having an underlying cancer condition as well. So now in cancer, we see to it that the patient requires a high calorie diet along with their intake as well. Because in cancer patients, there is also cancer cachexia which occurs, due to which they also experience some amount of undernutrition as well. And during this time, it can be very challenging also to meet up to the protein requirements. Now, in chronic kidney disease patients, the protein requirement is calculated based on their current body weight. So we generally take it as 0.8 gram of protein per kg per body weight per day, beyond which we cannot exceed. The kidney function has already slowed down. Though we understand that kidney plays an important role in the flushing of the toxins as well, and also it plays a role in reabsorption of certain nutrients. However, it is also very important to keep in mind what should be the protein recommendations during this case. So generally it has been shown that plant-based proteins are generally well tolerated and are recommended for the patients who have chronic kidney disease. So you can also include tofu, you can include soya bean, you can include A2, paneer, pulses and legumes as well. Also we can include whole grains which are low in potassium. Now, when it comes to a patient who is having chronic kidney disease and is also having cancer, we need to also ensure to monitor his blood parameters as well. Always before planning a diet, it is very important to check your electrolyte levels, which is your sodium and potassium, hemoglobin levels as well. And also it is important to ensure what is the estimated glomerular filtration rate, because this is going to tell us what is the how is the kidney function. Now, whenever we are planning a diet for the kidney patients, we need to incorporate low potassium foods in the diet. Now, low potassium foods could be your apple or it could be a pineapple, all the gourds commonly, which is your ridge gourd, snake gourd, bottle gourd as well, and even fenugreek as well. So these are some of the low potassium foods which you can incorporate. Whole grains like millets or oats are rich in potassium, which has to be restricted in the diet. Fluid recommendations will vary from individual to individual, especially if they are taking hemodialysis and or on cancer treatment as well. The fluid restrictions will be told by the underlying nephrologist or the oncologist. Generally, a salt recommendation of 3 grams per day is advised for these patients. It is very important to also note down their current weight, though they can also have sometimes edema in certain conditions. So we need to also know what was their baseline weight during consultation as well. So, to conclude, it is very challenging and important to monitor and give the right nutritional intervention for the cancer patients who are also having chronic kidney disease as well. And we need to give them a customized diet based on their individual requirements, keeping in mind to give them low potassium foods, a renal diet which is also salt restricted as well. Thank you for watching my video, and we at ZenOnco.io are here to navigate you through your cancer care journey. For further assistance, you can surely reach out to our cancer care coaches on the below mentioned contact number. Thank you.